I've been in LA since I was like 3 years old.
Yeah.
My family actually immigrated. I was born in Romania, and then
Okay.
we moved to New York when I was 3. And then we stayed there like 6 months with some relatives. But then my mom had a best friend that lived in LA. So right before the LA Olympics in '84, we
Yeah.
moved there. And then I grew up basically Inglewood initially,
Mm-hmm. Mm-hmm.
and then I went to elementary school in Santa Monica,
Okay.
on the Santa Monica Venice border, and I
Right.
stayed there until 10th grade when we moved to
Right.
Orange County. That's when my parents got a little bit of money, and we moved down to Orange County. So I went to high school in Orange County and then college in Arizona, Tucson.
Okay.
That's where I met my wife, and we moved back to Anaheim for like 15 years. That's where I started the sites and all that.
Yeah.
When we first met, I was like on my last few years of being there, unknowingly
Mhm.
still.
All right.
And then I came to Yuma now, where my wife's from, to have kids, and then decided to start a site out here too because I got bored in a way.
Yeah.
Or I can't help it, man. I can't help not
It's
doing
you. It's
something.
engraved in you. It's engraved
Yeah,
in
I
you.
think it's
You'll
in the
do it anywhere you go.
DNA. And that's part of like Patient Ace. Like Ronick started Patient Ace. And I remember we did a Zoom call with Ronick during COVID.
Yeah, it's
Mhm.
COVID time.
And, he came from the hospitality space, and he figured out, like, he thought he figured out how to get patients because he was a patient. He was trying to do a study himself, and
Mhm.
he was getting frustrated with the lack of phone calls, getting back. So planted the seeds for him. And once I found out that he actually started Patient Ace, I was like, dude, let's join up and do this together, man. We'll use it in Yuma, and we'll get some sites interested, and that's where we are. But we got LA born and raised. We got ourselves a squad now with the
Yeah.
Lakers. Tres leches.
But it's leches, huh?
I can name two of the
It's
three
two of the
leches.
three.
Luca, Austin Reeves. The third one's the center, like some foreigner. I don't know
Yeah. Yeah.
his
Yeah.
name yet.
Can't remember the name. Yeah.
Okay, you either, then we're good.
Yeah. Can't remember the name. That's for sure. There's a quite a quite a good team anyway. But
We got ourselves a squad now.
yeah.
I'm
Absolutely.
excited about that, and I like the hat. I like that style of the hat. So we got Jesse Padilla, who's a site owner, runs a site in LA, Valiance Research,
Mhm.
and
Valiance
they've got.
Clinical Research. Yeah.
Oh, go ahead, Valiance.
Valiance Clinical Research.
Valiance Clinical Research. They have 3 locations in LA. Do you want to just give a little
Yeah.
background of yourself? And
Yeah, for sure.
okay.
Absolutely. It's a pleasure to connect with you guys again. And but yeah, we have multiple sites. We have the three in the Los Angeles County area. We have one of our newer sites in San Diego, who's getting pretty busy now as well. And then we have two sites, and those are all solely owned by Valiance. But then we have two other sites that we co-own. One of them in West Covina and another in Granada Hills. So we help
Oh,
develop
nice.
those, manage them, oversee, supply the studies, and get them off the ground, help them keep it going, and keep up the good work. But the other four sites are solely owned by Valiance Clinical Research.
Oh, wow. Okay.
Mhm.
And when you started with us around 2019, right? Were
Yeah.
you was this already a company, or were
So
you
in in 2019, that's when the kind of idea really grew on me. Where as a coordinator at the site that I was in, I was practically doing everything, top to bottom, A to Z. Eventually, I got into doing budgets and contracts, and then I started. I got my first study, and then um, it kind of stemmed from there. I had the doctor already, connected with that doctor, along with my brother-in-law. But we connected with the doctor, brought in one of the studies that I found, and ultimately took that study, ran with it, helped the site get going, and the hunger just kind of continued to grow from there because I wanted to get more projects. So then I started looking and researching. I would go and watch your videos on how to identify projects, clinicaltrials.gov, reaching out to sponsors and CROs, the whole 9 yards. And I got my second hit, um, I think around January, February 2020. So this is obviously
Mm,
peak COVID,
yeah.
pandemic, and um,
This was COVID,
yeah,
like cruise ships being docked at all the coasts for
Yeah,
potentially quarantining people. It was crazy.
horrible times.
People they were
So
turning carnival cruises into like floating jails.
yeah, yeah. Unfortunately, that study got shut down
Mm.
towards the startup phase in beginning, I think second or third second quarter of 2020. Um,
Wow.
Fortunately, sometime down, like I think in August, September, I got another study lead. Got that study going. December 10th, 2020. We actually randomized our first patient as Valiance clinical research.
Oh, nice.
um, and kept scratching and clawing at that point, trying to get more projects. Got my next big project, I think around February 2021, and then it just kept coming. But then again, you're just thinking we need more because study enrollment closed and patients are finishing. You got to keep the lights on. So I came across one of your videos where you mentioned the services that you guys provide for study leads, and reached out and got that going.
Wow.
And it's generated a few successful relationships. More importantly, it's not just about getting one study; it's about the relationship
Mm.
you
Yeah.
um, that you retain from that. Because then these are the sponsors and CROs that see you as a valuable site, and they keep coming back to you. So it's not just that
Of
one
course.
study that you're
And in
providing.
SoCal, it's hard to do. It's one of
Yeah.
the more competitive markets that exist. Maybe just outside of Miami and Houston,
Right.
it's
Yeah.
probably right up there.
There's
Number three.
sites. There's 3 sites in one block.
Yeah.
Oh, really? Wow.
I'm not kidding. Yeah, there's literally 3 sites, like 3 different research sites in on our street alone.
Do you guys overlap in like indications and stuff? Like compete with?
Yeah, we have some studies where the site down the street has the same project that we have, right?
Wow.
How
But
did that
obviously,
happen?
we
Someone
have.
at the CRO fucked up.
Well, ultimately, the way we pitch it is, we have our own patient database. We
Mm.
have
Hmm.
I think 30 doctors in our network, and we have urgent cares and all these facilities that we connect to, that we've probably come out on top, and we're a little bit more successful because of that. But yeah, I mean, it's a very saturated market: Los Angeles, Florida, Texas. But nevertheless, I think, again, if you're performing well, and you're hitting the metrics and quality is there, they're going to keep coming back to you.
That's interesting. So, can you tell us more about your referral network? Like, how did you set that up, and how does it work? Is it is there a formal kind of setup, or is it kind of ad hoc?
So, no, very good question. But we contract all of the physicians, right? So they become essentially either sub investigators or referring physicians under contract, NDA, BAA, and they're getting paid for the hours that they work. Obviously,
Sure.
anything other than that is kind of frowned upon in not just in this industry, but in healthcare in
Mhm.
general. And then we meet with them frequently, provide them with the documents that they need, the resources that they need, and whenever they identify a patient, whether it's through chart review or during routine visits, they let us know of the patient, they talk to the patient, and make that first connection. And somebody from our site, usually it's going to be the sub investigator, one of the site leads, will reach out to the patient and give them a little bit more information. Patient is interested, we bring them in and carry on the process. Um, and then, of course, one of the big things that we started doing this year has been a lot of community events, health fairs,
Mm.
social events. But by far, I think the biggest thing that we did was sign up with Patient Ace, because that kind of like, people, it pushed people with all of our coordinators, with their backs against the wall, like, oh my God, how do we handle all of this? The leads. And one of the great things that we've taken from this is, if they're not eligible for that one study that the patient inquired about, we kind of dig in a little bit more, and we're like, well, you
Mm.
qualify for this one. Why don't you come in and at least screen for it, right? And I heard of Patient A's because I was watching one of your videos, Dan, and you mentioned Patient A's. You plug it in, you do a great job at that. So I was like, you know what? We've tried so many. We've tried at least 5 or 6 different vendors that have kind of the same model, I would say, in terms
Mm.
of pricing, in terms of productivity and how they deliver. So when I had that meeting with Ronak, it was a lot more enticing. It's that kind of whatever you want to put into it thing, right? If you want to increase this, you can have multiple projects going off at the same time. And at this point, I don't even know how many studies we have with patient A's across 4 or 5 of our sites.
Yeah,
Um,
it's almost probably close to 20 now,
yeah.
with us. But um, that's interesting. So you had gone through, like, 5 or 6 different vendors, and I think that's kind of part of the process of owning a site, right? Like, you want to try different ones and see what works, what doesn't. And we're always trying to learn, from the market. What are some of the good things that good experiences that you had with those vendors?
Some of the good experiences. Wow. I have to
Or maybe I
really
should just keep it neutral. Like, what were the experiences with the vendors, good and bad?
I, it's kind of hard to really pick on the good, to be honest.
Mm,
And I'm not, sugarcoating it at all. It's just more so of we would just get leads. Like, it was just name, number, and
yeah.
you know uh, what study they kind of inquired about.
Okay.
And most of those, I would say, a very, very good chance that it's maybe 96, 97% of those patients were screen fails,
Hmm.
and didn't meet any of the criteria. I'm not sure how their setup was, but um, and then obviously the pricing was another
Mm,
con, because you're
sure.
paying for a very short 30-day campaign, you're dumping all this money into it, and you get very short return for your investment.
Mm,
Um, and I guess that's where the big difference in our view is, where patient Ace does a much better job, right?
mm.
You have control over it.
So you were just getting very generic information, like name, number, and study.
Right.
Like, there wasn't any pre-screening information or data or filtering process in that.
It wasn't very effective. It wasn't very
Okay.
effective, and it kind of just seemed more like, it was, patients had, I don't know, it wasn't too clear for patients, I would say, maybe. Um, I'm not sure how their ads would even
Hmm.
look, but um, it wasn't very effective. I'm pretty
Gotcha.
sure they did some kind of pre-screening, because we would give
Sure.
them information, but we never got to really see, like, okay, what are the questions that you're asking,
Mm.
right? They would just create the ad, create the campaign, and it's live. Here you go, and you're just kind of, twirling your fingers, right? But it's very good to see, like, the way you guys develop it is, this is what we're asking, this is how we're categorizing,
Mm.
and this is how we approach our attack as well.
Gotcha. Yeah. So that's good to hear. Can you talk about like, how difficult was it to kind of get acclimated to the system, and, like, learn it, and kind of get onboarded?
Um, it was very straightforward. I think you guys did a great job at, obviously being available to answer the questions once we were set up and active. Um, and I know that we had multiple sessions where we kind of connected with you, and
Sure.
I believe it's Alexis that kind of gave us that support, that rundown, and very accommodating in terms of which sites want to do that schedule phone
Mm.
call versus when they want to have that scheduled phone call, versus the ones that just say no, just send them all over, and we'll call them. So set up the whole process, very easy, effortless almost. You just type in the information that you need, get that phone call with you, and get the project off the ground. I think from the first one that we did to the later ones that we've done, it's been a lot faster. I think within, I don't want to like oversell it either, but like maybe 72 hours, the study's live. And
Yeah.
again, it's one of the great things is that we've been able to go to you guys and tell you guys,
Mm.
here, can we tweak this here, tweak that there, because this is what each site, and this is going across each site, every
Sure.
site to work different, and you guys are very accommodating for that, so that's definitely a big plus.
Yeah, so it's funny because, like, nowadays, technology is increasing. There's AI, this, every other vendor is about AI, this and that, and we like to make use of it where it makes sense. But at the end of the day, like, one of the core values for Patient Ace was that we wanted sites to be able to reach a human, and get support. Like, coming from the site world, we know that you guys are dealing with like 50 vendors, and and like 10 studies and like so many logins, and then you've got your CROs, and then you've got your sponsors, and it's like there's just so much going on, and it's like at the you don't want another portal where you have to like learn or go through like a training or an onboarding. It's just like, okay, get on and like can a 7-year-old use it? Yes. And so we wanted it to be easy, number one, but more importantly, like when you need help, you don't want to go through like a chat bot, or you don't want to go through like, oh well, send an email, or talk to this person in the Philippines. Like, you want
Right.
somebody in your time zone
Yeah.
that can like respond to an email the same day.
Right.
So I think that's something that we've invested in that, and it's paid dividends, because it leads to happy customers and happy clients. So and it's funny you mentioned the 72-hour turnaround on the studies, like the new campaigns. So once you're onboarded, obviously, then um, we can do things a lot faster. Um, we're actually working on getting that down to like same day, because I don't or next day, because it's a long process. Like, part of the I think one of the differentiators for Patient Ace is that um, we'll look at, let's say a site has 3 studies in the same indication. We'll actually look at all 3 of the protocols and custom design a questionnaire that helps us basically do the differential between the 3 studies and patients, so that the site just has to see everything is automatically categorized, right? You've
Right.
seen that into not only like an A lead, B lead, C lead, but we've had sites that say, okay, we have 2 obesity studies, and then we want to prioritize this one, but then if they don't qualify for this one, maybe they might qualify for that one. So
Right.
there's a lot of custom work that goes into it, and
Absolutely.
there's some upfront work to it, but at the same time, it pays dividends, because you get better results. The sites have better leads, and um, like I think one of your sites, was it Northridge? Like, she um, just casually mentioned that, oh yeah, we're like one of the top enrollers for the study. I was like, oh
Yeah.
yeah, I mean, we hear that a lot, right? That's not unusual, but sometimes we don't even know what the results are, because sites are busy, and so we never have, sometimes they don't have a chance to mention it. But that leads me to something else. Like, I would say that the staff that I've encountered with your sites is really top notch, and
Yeah.
that really
Thanks.
makes a big difference. Can you kind of share your process for, like, how did you find your staff? How did you select them, and put together this sort of team that um, I get this feeling that, like, I'm working with A players, right? And I can't say that for every site that we work with. I wish we could, and part of what we like to do is kind of help sites become A players. But um, there was one incident where we actually we'll run a test initially for any campaign where, like, we might opt in for a campaign just to make sure everything is running. And I remember I got a call from someone from the site, and they don't know who I was. They thought I was just a lead or a patient. And I think that happened 2 or 3 times for 2 or 3 different sites. So the fact
Yeah.
that they're following up like so
Yeah.
quickly, they're on top of it, and it's not like they're not waiting around like, oh, how do we use it? No, it's like, hey, we got a lead, let's get on it.
Yeah.
And that makes a big difference, and I think that's why you guys have done so well and grown so quickly.
Right. Yeah, absolutely. I think as far as finding the talent to do that, we've been able to distribute the load for one. We're not expecting one coordinator to do that.
That's big.
We
Yeah.
kind of assign it. So if we see, leads coming in, they try to schedule it. Hey, at this time, you're going to call X amount of patients that came in. They distribute the load. And ultimately, I mean, as a site network, we basically collaborate all together, right? What's
Mm.
working at that site, this site, and what can work for all of the sites, including this patient outreach when a lead comes in. It could be a lot better on our behalf. But it's also because we're getting so many leads from it, and this sites are getting so many studies, PSVs, IMVs, and we're working and brainstorming on how can we really follow up with every patient as soon as the lead comes in, because I think
Yeah.
that's when you get them hot, right? One of the great things about it has been also that the chat feature, right, where we can respond to a patient or respond to them about their scheduled visit. They have that connection with the site, patient ACE, and they know it's not just some kind of scam likely deal where they're not going to respond or
Yeah.
block your messages. But no, man, I mean, I think site directors, they hold it down. They know what keeps the lights on and what we need to
Sure.
do. But distributing the load, not expecting one coordinator to call 50 patients in a day and then do 10 visits a day and then
Yeah.
address queries, deal with the monitor. So it's like distributed.
Mm.
If we got 10 leads that day, each person's going to call 3 during their scheduled time. So
Sure.
that's been effective. Again, I think we just need more hands on deck to help with this.
Yeah, it's
calling.
we're kind of helping with that. We have a pilot
Yeah.
with Valiance where we're doing the follow up for them within a minute. So that's actually going to start this week.
Yeah.
So we're very excited about it. We talked to Ina, and we're actually going to. So again, and this goes back to like quality of the staff, right? So we were trying to figure out, okay, so once we identify a lead and once we talk to them and ask them the questions and they're qualified, do you want us to schedule them on your calendar? What how would you like us to proceed? And she's like, oh well, just call me right then and there, just transfer it and I'll drop everything and I'll talk to them. And I mean, that's really the mentality that you need, because if that's true patient centricity, right? Because it's like,
Yeah.
okay, you have a patient, it's a hot lead, they're qualified, they've talked to you, and now it's like, what do you do? Are you going to just leave them and then talk to them 5 days later and then they forget about you? Or
Of course.
like such, like transfer it. So we actually designed the process for your site in
Right.
Northridge to, like, okay, we're just going to do warm transfer, and then the call goes through, and then hopefully then we get the patient scheduled.
Yeah.
I that's part of our ethos, is just the making sure that we are aligned with the site process rather than making the sites aligned to our process.
Right.
So again, it's like the technology has to serve the site. It's not about, oh well, this is how the software works, so this is how you do it. It's okay, our process is this, and in many cases sites might not have a process, and so we'll make some
Right.
suggestions like, okay, let's try it this way. The sites that we work with that are successful, they do it this way. So this, everyone kind of learns from each other and kind of gets the benefit of all the knowledge and best practices.
I agree. I think that's one of the things that makes you guys stand out from other vendors, right? Is the flexibility. And I mean, at this point, you've adjusted, I think, 4 of the sites that are currently using patient ACE to their preference, right? And yeah, I mean, they that's one of the things that they've been able to appreciate as well, is that they're not just stuck to one process.
Yeah.
I know I can tell them, like, if they come to me with some requests like, hey, can we do this instead of that? I'm happy to tell them, hey, here's Ronak's email.
Yeah.
Go ahead and reach out to him, or Alexis, and then literally the next day or the same day, almost, you guys are already, having a meeting, and next day that discussion is already implemented. And I mean, to mention on Ina's efforts, like, she'll message patients if they don't answer and gives her phone number, and the patients will call her on the weekends, on
Oh, wow.
Sundays, holidays. She'll take the call and
Yeah.
screen them.
Wait, who is this? Your staff? We need to acknowledge them right now. Who is this?
This is Ina. She's one of the site directors. She's the site director at the Northridge.
I said director, of course.
Yeah. But at all of them, really, all of the site directors are like, here, I'm available. Just go ahead and give me a call.
That's great.
They're hands-on. They're very
Mm.
involved. Again, they know the successes in screening,
Mm.
retention,
Now,
recruitment. Right. So
Eckhart Tolle wrote a book called The Power of Now. Nothing else matters now.
yeah. Patient, if a lead comes in, that's when they're
Yeah.
more open to talking to you. So otherwise, that's the flexibility, just like you were saying, Ronak, is accommodating to each site. Not every site operates the same way, and catering to what will make that site successful.
Well, shout out to
Sure.
Ina and Alexis. Zactivate, thank you, man. I appreciate it. Look into Patient Ace if you got a site, or if you don't, consider starting one.
Yeah.
Just
Yeah,
not in
actually, so
SoCal or Houston or Miami.
we got to start a new designation, like golden clients, like they're clients of both DSCS and Patient Ace. Like
No,
they got to
that's
be
like
like
diamond.
platinum,
That's like diamond.
diamond. Yeah,
It's
exactly.
gotta be diamond.
We got to do something. I think we should come out to and do like a video podcast at Jesse's sites. That would be cool to see.
It's not that
For
far.
sure.
I mean, which one? I'd
Anyone,
like to go to
all
the
of 'em.
Inglewood. That's
Yeah.
back to my roots.
The Huntington Park one. That's the one you want to go to.
HP, man. Yeah, no, that's there's definitely good food around there.
Just leave your car with the valet; they'll take care of it.
So what kind of and we haven't even talked about this, but like I think Tarzana your first site?
The first site we had was actually in Southgate, which we outgrew.
Okay.
That was embedded in a doctor's practice.
Okay.
We were there just a day or two, and then eventually we kept getting more projects, more
Yeah.
shipping boxes and lab kits, and had to get more stuff. So
that doctor's probably like, "What the hell, Jesse?
yeah. I mean,
what are you gonna pay rent here?"
Yeah, his staff wasn't very happy about it because we turned their break room into a lab room.
Oh no, they hate that.
Yeah. But the doctor was, I mean, he saw where things were getting better. So ultimately, we got more projects. And again, I told him, I was like, hey, look, I think it's time, I move out and get a bigger place because we can accommodate this. And he's like, no, you stay here. Let me get out. Let me get out. Because of course, my thing was if I'm gonna leave, I'm gonna bring some finances with me because I'm no longer using your space. And he was like, no, let's leave it as it is. There's no, I'll get another spot. So he moved out. Again, we just continue to grow. And I think at that point I did start Tarzana kind of in between.
Was that an internist or what?
He was internal medicine and nephrology.
Okay.
Yeah, so I was able to kind of bring in different.
Oh, nice.
Yeah.
Were you doing like CKD studies too?
A ton of CKD. That's how we started. Like, I mean,
they had dialysis centers there, or you guys used?
Yeah, he didn't. He had dialysis centers. He was contracted with them, but he was more like with the big networks, right? Like the Vitas.
The Vita. So you guys worked with the Vita and them?
We didn't. No, at that point, we were not comfortable giving up the revenue that they were requesting for us to go in
they
there.
do research now too.
They do research. Yeah, they have their own thing going. They're big. They're huge.
Yeah.
We're now establishing our contracts and relationships with the Vita and Fresenius to start working with their facilities. But he moved out. Then we ended up moving out. So Southgate was the main one, and then that turned into Huntington Park, which is where we're at now. It's a huge, like I think 3,000 square foot space. Tarzana came next, Northridge, then San Diego, and then West Covina, Granada Hills.
So Tarzana's your biggest. You have your most studies there, right?
Yeah. Tarzana, I think, has 20 plus going on right now.
Wow.
Yeah.
It's been a minute since I've been to Tarzana. Wow, that's way
out.
I mean, and is that just the location? That's just like it's just a hot location, or is it like something unique?
So in Tarzana, we have the most physicians, I would say. We have different specialties there. So we have nephrology, cardiology, pulmonology, ophthalmology. I don't know what other ologies we have, but we have quite a few.
This is all integrated. Is it integrated into practice or
no? It's a dedicated research site.
Standalone.
All the doctors are standalone clinics. They're their own private practices in the surrounding area.
Gotcha. Okay. And then they just come in to see their research patient.
Right. Yeah. So we rotate them to come in, see their patients. We have PAs and NPs to serve as their sub-Is in case the PI's just not available to come in. But I mean, so far it's worked out well. Our GI actually, when I was about to get the lease for Tarzana, I bumped into him in the elevator and I saw his badge that said, he's an MD gastroenterology. Parexel
Yeah.
had just came out and emailed me about a GI study for I think ulcerative colitis.
Mm.
And I asked him, so you're a doctor, and yeah, we chopped it up in the elevator ride, short 30-second pitch.
That's
And
a
I was
true
like,
elevator pitch.
yeah, I was like, I have a study, I do research, I just moved into the 6th floor. And he said, come see me on the 5th floor at 12 p.m. and the rest is history. Now he's
Wow.
our GI
Wow.
and hepatology PI. And I mean, that's just thankfully how the cookie has crumbled. Everything
Yeah,
has
no, that's great. That's great.
That's a good
Yeah.
cookie.
Absolutely.
That's not easy to do out there. The doctors out there are like all, busy and hustle and bustle.
Right. And
That's tough to do.
I think, if you're able to kind of provide the sufficient support, right?
Mm.
Good coordinators, sub investigators that can, kind of relieve some of that, on-site commitment, because they're so busy, like Dan is saying, going to hospitals and dialysis centers and nursing homes. You want to kind of accommodate that. And now that we're also doing, e-sources and e-reg,
Mm.
it's even easier for them, so they can sign things off, remotely, and they're not obligated to come down and sign 50 charts with their pen and paper.
Yeah, that's a
So
big deal.
that's working out for them too. But everything is kind of integrating into such a wonderful, pretty solid operation so far.
Yeah, I mean, it's cool to see everything coming together, because it's like, you start out and you have one site, and then you're growing. And you got to keep the systems together, otherwise everything falls apart. But
Right.
there's an art to being able to do that, and you guys I think you've threaded the needle like pretty well.
Yeah.
How do you find your CRCs and staff? Like, where do you get them?
It's a couple ways. I mean, honestly, initially it was Craigslist, a lot of
Yeah.
Craigslist, and just kind of looking for like MAs and phlebotomists to help,
Mm.
because I was the coordinator as well,
Yeah.
right? When I was starting, the whole operation. So I just needed support. I needed somebody that can draw blood and do some ECGs and do this and that. But as time went on, the operation got bigger. We started looking for kind of more qualified individuals,
Mm.
foreign MDs, foreign nurses, foreign PAs, foreign NPs. They come in with that medical knowledge. So
Yeah.
when you bring them into research, it doesn't take them that long to get the
Sure.
hang of it, to know what's important and what's not. So we're kind of shifting our attention to that criteria. But another way that we've gotten our coordinators is we have phlebotomy schools who send their students for their
For training.
externship.
Yeah, yeah.
So they
That's
come
really
in, we get to see who they are, we get to see how they are, how quickly they absorb things. And granted, I mean, they're just kind of doing other miscellaneous items, but we've picked up a few
Yeah.
just from these phlebotomy schools.
Mm.
And yeah, I mean, that's been a hit. That's how we found these coordinators. We get to see, I mean, just in a short week, you can tell how a person, works.
Yeah.
And I mean, ultimately, it's the job of the site director to kind of identify that talent.
Sure.
I'm not going to say every single one has been a hit, but the ones
Mm.
that we have now
Yeah.
are sticking around because they're doing a wonderful job.
So your foreign MDs and things like that, they're like sub-Is, or do they become CRCs, or?
They become CRCs because, I mean, they're not licensed to practice here.
Right.
They're not able to be sub investigators.
Sure.
But they're incredible CRCs.
Yeah, I can imagine.
One of our CRCs who started off with us last year just got a pretty significant promotion because, again, she came in as a coordinator. But I mean, she's pretty much doing the director's job.
Yeah.
Helping the director, and we promoted her to assistant site director, which is the first. Okay. Yeah, it's the first of its kind in our company, at least. But she's just giving us everything.
That's awesome.
Yeah.
And it's one thing, I can imagine, like with CRCs, like especially as a foreign med grad, like they probably don't stick around. They're obviously overqualified for coordinator positions, so it's hard to keep them around for too long. But if you have a path where they can grow and kind of stay with the company, then that's whole different ball game and a whole different story. Then they don't have to go back to school. They can make what I'm assuming is pretty good money, 6 figures plus, and without having to do another 4 years of school and board exams and all that stuff. And it's a nice option.
Yeah, yeah, and we welcome that opportunity, or we welcome that that decision, right? Where we have foreign MDs
Sure.
that they tell us basically, hey, I'm going to be here until I get into residency. But
Yeah.
I mean, in that short amount of time, because they're wanting to retain more information, because they're getting so much information from the research operation, that they're involved. They're highly involved. They make sure
That's
that
one of the things that the big markets have a lot of the IMGs. We have one IMG with us, Daniela. Amazing. She doesn't want to be a doctor in the U.S., but we got her on the medical monitor pathway.
Yeah.
I'm telling you, she's one of the most motivated staff I've ever had at any of my sites.
Right.
And those IMGs are, if once you get a good one, they're worth their weight in gold.
Yeah. There's so much knowledge that they are able to use for their whatever their future goal is, whether they want to get into residency, become a doctor, or do something else with research. I tell that to every person that we interview is, if you stick along for long enough, there's so many doors that can open for you in clinical research. It's not just within our site, but
plus Jesse will get you floor seats at the Lakers. Doesn't hurt. You just have to randomize 2 people.
We just have to randomize quite a few patients.
How many like just a rough number, how many you can mention either like an indication or a study, or just like I'm curious, how many patients do you think Patient Ace has randomized for your sites?
I think collectively, since we've probably been using your services for about 2 or 3 months now.
Yeah, maybe longer than that, I would say.
Okay, I would like to say
April,
well over. Yeah, I would like to say well over 150 patients.
Wow. Yeah.
Well over 150 patients, and that's being, I think, on the conservative end.
Sure.
I know that as we were talking, was it last week? The staff hasn't updated the cards, but that's probably because they're randomizing, they're screening, they're screen failing. But I would say easily, especially in the Northridge location, it would have to be well over 150 patients.
And so that's like, what has the ROI been on your investment so far? If you just had to pull the number.
I mean, if I have to say anything, I think I've seen the numbers go up. I mean, when you kind of see the bank accounts not really take hits as much before, that definitely it's definitely worth it. But it's hard. I mean, I would have to kind of really sit down and pull some numbers in together.
But like at least multiple 6 figures per site. Is that fair to say? Or
that would be fair to say.
Okay.
That would definitely be fair to say.
Yeah, I think I think that's a win.
Oh, absolutely. This is why I told you last week. I was like, hey, increase these ads to $100, $150 a day, because I know it's gonna give us that return.
Yeah, so we have the ability for sites to tell us how much they want to spend in their ad budgets, and so typically they start off at 30, and then we have sites that are that stay at that level, and we have sites like Jesse's that every time we talk to him, he's like, okay, up it, more leads. And we have sites that spend hundreds of dollars a day per campaign. So it's really all across the board, and it's if there wasn't an ROI, sites wouldn't be doing it. So it
wouldn't make any sense.
Yeah, I like that. What else? What else can we say? If somebody's considering, Patient Ace, what would you tell them? Can they reach out to you? And if sponsors, are interested, how can they get in touch?
Absolutely. I mean, I'm happy to, obviously recommend the service. We're incredibly happy. I think it's 5 sites total. So I know it's 4 Valiance sites and one of our the West Covina site. Who I've checked in with. So I know they're having a hard time getting started. So 5 sites, the 6th site is basically on the verge of getting on as well. Highly recommend it. I think, especially to give it a shot. I know that there's that entry level entry premium, which isn't much if you consider it comes with, I think, a month or two of the service
Mm.
um, and again the flexibility. You can have those multiple campaigns versus just one campaign for the same amount that you would pay the startup fee for patient
Yeah.
base.
I think
So
we're really we're giving away the farm, but that's okay. We like sites.
you guys are doing great. You guys are doing great, and I think that's what really enticed us to do it. Otherwise, I don't think I would have. I've been like, man, I've paid this $5,000
Yeah.
for a 30-day campaign, and it gave me, not what we desired.
Mm.
As far as contacting me, happy to talk to any other sites. If you guys want to plug in my email address, phone number, whatever you guys want to do, plug it in, on the
Your
chat.
LinkedIn. We'll have your Jesse's LinkedIn underneath this video for those not watching live.
Perfect.
Happy Veterans Day, by the way, to everyone.
Veterans Day.
Should have started with that, but we got
Yeah.
Tres Leches. I got too excited with the Lakers.
Absolutely. LinkedIn is perfect. Anybody can reach out. I'm happy to, give them, my 2 cents. And again,
we gotta get you to SOS this year. It's in San Diego.
yeah.
Oh yeah. We'll be there. So
is that in December?
March.
Oh, March.
You didn't go to Oklahoma, right?
No.
And
it would be my
did you go
first
to
time
Tucson?
attending one of these.
No wonder, man. Yeah, dude. No, it's in your neck of the woods now in San
Yeah.
Diego. I mean,
it's a
our
great
neck
conference.
of the woods too.
Yeah, I'd be happy to. Just definitely remind me. I'm pretty sure I'll get the invite, or I'll see some kind of communication. But I think this year we're looking at more networking, more outreach. So we'll definitely be interested in meeting up with you guys. But if you guys ever come down here, floor seats.
Yeah.
Oh,
I think we need
Of
to bring the camera over to Jesse's sites and just show up and
we show up with Daniel Rodriguez. We don't
Yeah,
need just
do it.
cameras anymore, man. We got Daniel's got to come, a whole posse, man. We got to make a vlog out of it.
We'll make
We gotta
a
do it.
trip out of it.
Yeah,
Absolutely. I'd be happy to have you host you guys.
Awesome. Great.
man. I think
Very good.
that's a wrap. I mean,
Awesome.
Jesse's somebody that everyone should connect with. Hopefully, we see you at SOS. And we need more community-based clinics like out there in the wild. And he's proof that you can do it in a big market.
If a site that can be successful in Southern California can be successful anywhere, and that it's like you make it. It's like they say, if you can make it in New York, you can make it anywhere. I think in the site world, it's so you make it in South Florida and you make it in Southern California, you can make it anywhere.
If you can make it in Huntington Park, you can make it anywhere.
Yeah,
that's the streets right there. Yeah.
I think that's a wrap.
I appreciate you guys. Thank you so much, and I'm here for anything you guys need.
Yeah, thanks, Jesse. I appreciate it. I'm glad we were able to make it happen.
Likewise.
And Jesse's
All right.
LinkedIn is underneath, and check out Patient Ace as well. Thank you, Ronick. Thank you, Jesse. Thank you, everyone, for watching. Bye-bye.